Today, I will be talking to you about stroke. Stroke is when the brain has an attack. It can happen at any time to anyone. When blood flows to an area of brain is cut off, and when this happens, the brain cells are stripped off from oxygen and will begin to die. During a stroke, when the brain cells die, the memory and muscle control are lost depending on where the stroke happened in the brain and how much damage it has caused to the brain. With a small stroke, it will lead to temporary weakness of an arm or leg, but with a larger stroke, it may lead to permanent paralysis on one side of the body or loss of speech. There are three kinds of stroke. Hemorrhagic stroke is where a brain aneurysm bursts or a weakened blood vessel leak. Ischemic stroke is where a blood vessel carrying blood to the brain is blocked by a blood clot, and also tear is when blood flow to part of the brain stops for a short period of time. The main symptoms of stroke are confusion, which includes trouble with speaking and understanding, headache, numbness of the face, arm, or leg, especially on side of the body, trouble with seeing with one or both eyes, and trouble with walking. It is important that stroke are diagnosed as soon as possible to prevent severe damage to the brain. And the best diagnosis and treatment is when the patient gets treated at a hospital within 3 hours of their symptoms first appearing. There are different types of diagnosis tests that doctors can use, such as physical examination, where the doctor asks the patient's symptoms and medical history. There's the blood test, CT scans, MRI scans, carotid ultrasound, Cara-Bra, angiogram, and echocardiogram. Therefore, different strokes will require different form of treatments. Stroke are life-changing events that can affect a person's both physical and emotional, and in order for a person to fully recover, they will need rehabilitating activities.